All right, well, you know, I think you probably know most of this, but we'll just have a quick look. This is a very nice little diagram, which of course you can't see it. If you can see that, then, you know, I think you should win a prize. But you can easily see this by going to the English version of Wikipedia, which is where I got it from. So you can see that their ratings, they're 58% of people have fatigue, 44% have headache, 27% have attention disorder and memory loss, cognitive stuff. Then you have the cough, 19% cough, 16% chest pain. Different doctors have different experiences with this. It's very interesting. I mean, I can give you what I've found, or Linky can say what she's found, but different doctors seem to have different experiences of the percentages of the important things. But my own list, well, the definition is long COVID is symptoms persisting or appearing after about 4 weeks after the infection. And these are some of the important things. Exhaustion and cognitive difficulties, these are two of the most important, and these are why people have to stop work. You know, doctors, nurses, business people, working people, they can't do it. They just can't do it. That's what stops people working. Now, we have also cough, usually a dry cough, but other people get yellow or green sputum because there's obviously residual lung infection, possibly from a secondary bacterial infection. Difficult breathing, fever persisting for weeks or months after the COVID, headache, muscle aches, loss of smell or taste. I'll just quickly say with the loss of smell or taste, this is, we haven't got formulas for these, but what I do is ask the apothec, in the case of loss of smell, to make very fine powder of Myrica cerifera, Vax myrte rinde. But it has to be very fine powder, because what you do then is you imagine that you're a rock star and you put the Myrica cerifera like you would, you know, the cocaine. Only a kilo a week, doctor? So you put it there and then you sniff it into each nostril and then you do a lot of sneezing. Now, in the beginning, we found that some people found this is very drying and irritating to the nose. So what we do now is we say to the people, do that, and then about 15 minutes later, get one of those nasal douche things, okay, and then wash out with saline both sides of the nose. Because otherwise they find, some people find, maybe 25% of people, that the nose gets too dry if they're doing the Myrica snuff twice a day, every day for a week. So this is effective in many cases. So that's my best suggestion for loss of sense of smell, in addition to any oral prescription that they're taking. The loss of sense of taste, you need to get, and again, very finely powdered xanthosxylum bark. This is not the Chinese xanthosxylum because that's a fruit. This is the bark. And you get this fine powder and put it on your toothbrush. Because the thing with xanthosxylum, it's interesting. It has a tingling sensation on the tongue, and it can help salivation. With people are not salivating enough, it helps them salivate more. and it can help the loss of sense of taste. So I'll just tell you these two things because a lot of people do have them. But I emphasize for Apotex, you need to make a fine powder. You cannot sniff bits and pieces into your nose. You want a fine powder. And it works around, in my experience, at least 25% of the people, and quite quickly too. The commonest long-term symptom is exhaustion. And it can be so severe that, as I said, the person can't no longer work, and they may be exhausted after even a short walk on flat ground. And we've had extreme cases with both adults and children with this, and teenagers. It's not just adults and old people. Cognitive disorders, it's difficulty focusing the attention and concentrating. Memory loss. You can't find the word that you want. You know, and the cat climbs on the dinner table, and you say, get the, and the wife says, you mean the cat? Yes, the cat. This is really common in chronic fatigue. This is very common in chronic fatigue patients, and many people have wondered about the similarity between these two, long COVID symptoms and chronic fatigue. The overlap, for example, is not the cough, it's the exhaustion, it's the cognitive problems, and it's the muscle aches. And in that area, the two things are very similar. Sorry?
Would the blood work show up for chronic fatigue, the EBV number?
That's a complicated one because I don't know that there's any really reliable test for showing in blood work chronic fatigue.
Well, the Epstein-Barr.
Yeah, the Epstein-Barr, but not everybody has that as a cause for chronic fatigue. Okay. It's a bit more complex. But yes, they can get that check, but there are other possibilities as well in chronic fatigue. If you go to PubMed, there's been some reviews of this, and it gives a list of the viral possibilities for chronic fatigue. But anyway, I'm going off the topic. So severity, it can. Well, I've already said this. And the cause of the cognitive problems is not fully understood. There's lots of ideas. Emotional disorders, pre-existing tendencies to emotional disorders can be aggravated by COVID. For example, depression or anxiety or fear. What it doesn't say there is anger. Now, if you have a constitutional liver problem, you are a wood-type person, then we had one patient. What is that? Oh, it's got. Ah, it's Robert. Wow. I knew you were bright. He's emitting light far out. Okay, so we had this patient, and he was an irritable Alterssack before the COVID, but after the COVID, he was a really angry Alterssack. So it can depend on what is your constitutional and personality type as to what your symptoms will be. If you're heart type, you may more likely have heart problems, liver type, and he didn't just have more anger, he had difficulty with food, nausea with fat, and all the usual liver things. So Yes, that's just what I've been saying. The system that's most affected will depend on partly on pre-existing weaknesses, whether digestive, diabetic, hypertension or cardiac weakness, hepatobiliary. So you have to be flexible. People aren't going to have set symptoms. They'll have symptoms partly based on their own constitution and their own pre-existing disorders and weaknesses. And if they're your patients already, then you probably know those. Now, the treatment strategy is long COVID problems can be minimized, obviously, by prevention. And I'm going to talk about, I'm not interested in the very emotional discussion about are vaccines good or bad. Well, it's really like America with Democrats and Republicans. It's sort of made families hate each other. And to me, this isn't really helping at all. So I'm just emphasizing what herbalists can do with this situation. So prevention, we've got formulas for prevention because if you prevent it, well, we don't have to worry about long COVID. Effective treatment of early stage infection, very, very important. If you can do that, then you won't have the long-term stuff. I haven't put, it's not the topic of this lecture, of the really severe early stage infection, acute infection. That's off this topic. We haven't got time. But I have formulas for that. They're usually based on Asclepius. And of course, we're talking about treatment in the chronic phase, and we're talking about rest. Now, that is it. That's your overall strategy. And if we just look at rest, and I'm telling you this because I've got colleagues, both doctors and nurses, who had acute COVID, and we're talking about the earlier times, before milder Omicron. They had it badly, they were in hospital, they got out. Of course, their first thought is, I've got to get back to work. You know, either in the hospital or in my practice. But the problem, we'll discuss the mechanism for this, is back to work too soon, but you should be resting. It will aggravate the exhaustion, it will bring back the inflammation, the hyper-inflammatory state, which we talk about in a minute. This heightened inflammation, many viral infections, this is what happens. You get the virus produces a heightened inflammatory state, and then you get the fever, which may or may not go away. Working while in this state can heighten the inflammation further, resulting in a return of the fever and all the other inflammatory symptoms. Now, it's easy to say that, and it's very difficult to do it. I know myself. But I have to say that because Linky and I were discussing this, and she said, well, why don't you follow your own advice? But this is super important. These people had a collapse. They were back in hospital. The wife sent one doctor back to the hospital because called the ambulance, and back he was. So we're not talking about imaginary things here. We're talking about things which really increase the exhaustion.